Good afternoon, friends. Welcome to another webinar of IAGS. And this is a unique webinar because this is first time. So many things are happening first time today. The Journal of Minimal Access Surgery, popularly known as JMAS, is conducting a training program or basically a orientation program on basic medical writing skills. And this program is being conducted by Dr. Anil Sharma, Dr. Sandeep Aggarwal, and this is basically to create awareness about how to write, why to write, and to share the techniques. And another first is that this is the first time that JMAS editors and Indian Journal of Surgery, these are two major publications from India, and their editors are sharing a stage together. And this is also to emphasize the point that how important this is that both the editors have decided to be together to help create awareness about this particular issue. Before we talk about the topic, I would welcome our senior past president of IAGS and an advisor, and very well known Dr. Pradeep Chaube sir, who is also the chief editor of this journal, JMAS, to inaugurate this and to say a few words.
Yeah. Thank you very much, Raman, and very greatly appreciate your leadership and also your presidentship for IJs and giving a new direction and new shape to the way we are thinking. And I'm sure it has this particular platform also has added and also reduced your travel. Otherwise, you would have been gone crazy. And I welcome you all for this webinar, which is very interesting webinar, and I'm glad that Sandeep is also there. And this will provide lot of synergy to the Indian academics and more so the Indian subcontinent academics. And at the helm of affairs, we have got great academicians which are known for their publication, known for their inclination of medical writing, and also they had that professorial sort of positions which encouraged medical writing. We all know it goes without saying that today more and more evidence-based practices are taking shape and coming in the forefront, and those whims and fancies of the surgeons and the medical profession is gradually disappearing. However, we have to be a little careful what we speak and what we follow, and definitely if it is supported by the medical opinions and also the evidence-based medicine, the legal issues are also taken care of, because we know that the patient community is becoming more and more litigant. So the first step of having this is how to do medical writing. What are the principles of medical writing? How it should be written? How it should be projected? How should it be published? And some of our colleagues have been doing this in the past on a different platform. But today I'm very happy that we are doing our first course. And as Raman has said, it's quite an important meeting today where two journals and their editors are coming together. And our interested young population also should understand that medical writing is very important. Publication has become an integral part of your future plans, unless you purely want to go into private practice. But any position, post, progress depends on your medical publication. So I welcome you all, and I will, with my best wishes, I will hand it over to Dr. Sandeep and Dr. Anil Sharma for conducting these courses and sort of letting our youngsters know. I'm sure we will have quite a few more courses in the future. But congratulations to all, and thank you, Raman, for providing this leadership to the young and not so young colleagues of our in India and across the Indian subcontinent.
Thank you, sir. Thank you, Dr. Chaudhary, sir. Before we move on to the academic component, I welcome Dr. Sandeep Kumar, who is the editor of Indian Journal of Surgery. He is past professor, ex-professor of KGMC, Lucknow, and founder director of All India Institute of Bhopal. So I request Dr. Sandeep Kumar to say a few words about today's topic and its relevance.
Raman, I will just interrupt on the lighter side.
Yeah.
When in '95 we had the Congress, first IJS Congress, and Sandeep may or may not remember, and day one was the workshop in All India Institute, and Sandeep was the first person entered for registration. So congratulations, and Sandeep, it gives us so
I'm
much of a
still a
pleasure
member.
to have you.
Yes, I'm a very active member, and I enjoy reading the journal. And now you're the editor-in-chief, and I'm the editor-in-chief for Indian Journal of Surgery. So let's join hands to do this workshop. Thank you.
We are always together.
Thank you. And thank you, Dr. Raman Goyal. Only lately I discovered that Dr. Goyal comes from Mathura, and both of us have common family links and things. So I'm very grateful. I'm very happy here to be on this forum. Thank you, Dr. Raman Goyal, for inviting me to be a part of moderator here. Dr. Anil Sharma, namaskar, and Sandeep Aggarwal, of course, I know him since his formative days, and Dr. Kritika. Good afternoon.
And Delhi is not too far from Mathura.
It is not.
Of course.
So today is a very, very important workshop, and I've been asked by the senior moderator, Dr. Raman Goyal, to say a few words in brief, introducing this little workshop, or whatever you may call it, a webinar on writing skills. Now, when we talk about writing skills, we're talking of scientific writing. Now, scientific writing is of two types. Only lately, as an editor, I received an article on hemorrhoids, and it was a nicely written article, quite a good, nice English, but the reviewer very nicely came out with the comment, great article for a newspaper, not fit for Indian Journal of Surgery. So scientists are writing two types of articles. One is as a visible scientist article. Paul Ehrlich was one scientist who was a visible scientist, to make the science visible to the layman, to the lay press, which is understandable. We all write small booklets in our clinic explaining people what lymphoma is and what obesity surgery is, and we write articles in lay press for lifestyle changes and explaining the disease. And that is a part of an ardent duty. In today's world of COVID pandemic, we are all writing articles for the lay press. So that's one thing. And probably and Dr. Goyal will correct me, the objective of this writing skills workshop is not to talk about those articles, but to talk about structured articles that we write and try and publish in the biomedical scientific journals for the in-house consumption of the scientific community. Am I right, sir?
Yes. Yes, sir. Absolutely.
So we all know that this kind of an article is a structured article. Way back 100 years ago, when Lancet and BMJ were the first biomedical journal, and the first biomedical journal which was published from Vienna did not have a structure, and people had a story way of telling, and which was perfectly okay. I mean, that was anecdotal and story way of telling science, that how they discovered something, how they made an invention, whether it was pure science or medical science. But then this IMRAD module came, where we have to have an introduction, then we have to have an abstract which is structured, and then we have a material and method, and then we have to have results and calculations, which is called data analysis and discussion and references. So that is the structure that we follow, and it is an important structure. So articles, as you know, are of many types, which the speakers will allude upon. I'll just finish by saying why it is important to be writing scientific articles. For the lay press, yes, but why in the scientific journal when of late there has been some criticism of the way some of the articles got published in very major journals, and those were criticized. So uh, they say if you can acquire skills, then you can continue to perform those skills whether they are benefiting the person or not. So you have to have tools to assess that whatever uh, uh, you are giving, as we as surgeons, because we basically surgeons, are actually showing our mechanical skills, surgical skills, which have a potential danger of harming somebody, or if not harming, doing may not be benefiting. So there will always be a competition with the available medical treatment or a different surgical treatment. So there are these issues of comparison, which is better on a population base, which is better, and when is it better, what parameters would make it better, and that becomes the need of writing a scientific article, and those becomes the study variables. So when you can do something, you're great. It's nice. You get popular, people come to you, patients come to you, you are a popular doctor, you start earning money, and you have a comfortable living. You and I start teaching and professing, become teachers. But as teachers, we can always say something. Maybe during the last 5 minutes, I've said something which may not have been correct, and I can always go back and say that, no, I didn't mean this, I meant this. But when you start writing it, my professor used to say it, that if you can do it, then the higher portion is you can teach it, and the highest is that you can write it. When you write it, he would say, Safed Syaha ho gaya. You have made it into white and black. And now you cannot rub it. Somebody else will rub it and say, this was not correct and this was probably incorrect. So once you start writing it, you have umpteen number of chances of editing yourself and getting it edited by peers. And then what comes out is really a very balanced thing, and probably the best of your life for that particular research question. And that is why I think I'll finish stops here, why this writing skills workshop is extremely important. It is a learned activity. You can write good flamboyant English or Hindi, but writing scientific journal articles is a learned skill. You are not born with it. That's all I would like.
Thank you so much, Dr. Kumar. I think that was quite enlightening. Just to be on the lighter side, one of my friend, a surgeon himself, wrote today that you are doing this course, people will have a better handwriting. So medical writing can be interpreted in many ways. So moving on with our first talk today, I invite Dr. Anil Sharma, who is Director of Endo-Hernia Surgery at Max Hospital Healthcare at Saket, New Delhi. A senior man who has been associate editors of many journals and is also the editor of Journal of Minimal Access Surgery. I welcome him to speak on why write or publish. And friends, please keep sending your questions. After every talk, we'll have a question answer session. So that as we move on today, we have 5 talks. We will be able to take questions relevant to that topic immediately after talk. Dr. Sharma, please.
Yeah, thank you. So I'd first of all like to thank the Indian Association of Gastrointestinal Endosurgeons, led by our president, Dr. Raman Goyal, to facilitate the online presentation of this course. Some of you may be aware that this course has been around for about 7 years, but now this course has a title, and this course has a purpose. So from now on, this course would be known as the JMAS Medical Writing Course. Can I share my screen, please? Right, I want to go to one, which is this one. So just a few thoughts about why write, publish. Right. So you got my screen?
Yes.
Okay. So right at the outset, I would like to start off by saying that this is not a professional course for the purist. This is a course that has been designed by practicing surgeons for the benefit of practicing surgeons who wish to write and publish surgical articles in peer-reviewed journals. Oh, in fact, this is a course that was born from discontentment, from frustration at the lack of knowledge and the lack of basic information to write and publish effectively. So there is a passion, there is a sense of purpose that drives this course. But apart from that, there is no other conflict of interest. So not so long ago, surgeons used to be regarded as cowboys because they believed mainly in action. There was no time for reflection, for contemplation, for audit. And like the Prof. Sandeep Kumar just mentioned, I was in fact, again, not so long ago, trained in one of the finest medical colleges in Bombay. And there used to be a dictum at that time that said that those who can do, those who cannot teach, and those who can neither do nor teach, write. But times have changed since then, and how? So we now have dictums that tell us publish or perish, publish and flourish. In fact, in these times of social media and information overload, things have become so bad that now we have dictums that say post or perish, and if you don't yell, you won't sell. So the role of a surgeon has changed as well over the decades and the years, and the surgeon now finds himself in the role of a thinker and a teacher as well, apart from being a doer. So I don't need to, in fact, tell you about the need to write and publish it in today's day and age, because we all know it is so important for our professional advancement. But would just like to point out that the grants for research funding come to those departments, those institutions that have a track record of medical writing and publishing. But apart from that, it's also about personal growth. There is a big mismatch today between what we can do and what we can write. In fact, there is a very big lacuna that exists today in the world as far as surgical literature from the subcontinent is concerned. So by writing, you can make that little contribution to your profession. In fact, writing and publishing is just like an act of creation, because you create intellectual property that would be preserved down the ages. The written word reaches the widest audience and constitutes the archival message. So like Prof. Sandeep Kumar was saying just a few minutes ago, if you want to get to the bottom of your subject, the bottom of your topic, start to write about it. So why do some countries publish more than others? Of course, it is research funding that drives much of publications throughout the world. But then, like I said, it's a cat and mouse game. You start to write and publish, and you start getting grants for research funding to write more. And of course, proficiency in the English language. And my feeling is that we here in this country have a significant advantage with the language. Now, there has been a subtle shift, a subtle but a definite shift in the way that we write, in the way that we publish, and finally in the way that we are read. So about 25 years ago, till about 25 years ago, surgeons used to write articles which used to get published in these paper journals. And these paper journals constituted prime source of surgical information. But then that changed with the advent of the World Wide Web. And now content from these paper journals started to get stored in large online repositories like PubMed. So the final destination of your article today is not the paper journal, but large online resources like PubMed, like Cochrane, Medline, and so on and so forth. So what that practically means now is that where you publish does not make that much of a journal, that much of a difference. Which journal you publish does not make that much of a difference. Because finally now the chances are that your article would be read online. And when that happens, we know that the online content is far more important than the online source. So I call this democracy in medical publishing. But then, mind you, certain things will remain in place. There are going to be certain minimum standards required for medical publishing, and there is going to be peer review in place for quite some time to come. So when a person really desires something, the entire universe conspires to help that person to realize his dream. So if I have permission, I may move to my second presentation. Is that okay? And then we can have discussion following my second presentation. Is that okay, Mr. Chairperson, sir?
Please go ahead, sir.
Right. So I am now going to speak on what to write. Okay. So there we go again. So starting from the most simple to the most difficult, starting from the easy to the more complex, starting from the lower levels of evidence to progressively higher levels of evidence. This is what constitutes surgical writing and publications. The letter to the editor, the case report, the surgical technique, which is also known as how I do it, the case series, the case control study, the cohort study. Now, the case series, the case control study, and the cohort studies, these are known as non-randomized observational studies, because in these studies, you don't have a randomized control group, which means that in these studies, you don't have a control group that is similar to the patients that are being treated. the randomized control trial, and then we have narrative reviews, systematic reviews, Cochrane reviews, meta-analysis, and finally editorials. So the case series, the case control study, the cohort study, and the randomized control trials constitute what are known as the original articles. Now, these normally constitute about 2/3 of the content of a surgical journal, and this is and these are the articles that provide the prime content that would establish the journal's reputation for quality. And then we have review articles, which is about 1 or 2 or 3 per issue. And these are the form of review articles, and we'll try and go through these one by one. So when you have decided you want to write, whenever there is a prospective study about to be done, what needs to be done? You first of all need to fill up your study protocol or your research protocol. Now, this is a standard document that needs to be all teaching hospitals in the country today. The study protocol is filled up, is submitted to the local institutional review board. You get consent from there, and your trial also needs to be registered at the Clinical Trial Registry of India, or there are some other trial registries where you can register your trial. And what does this study protocol comprise of? These are the things that are part of the study protocol. Why you want to do the study, what sort of a study design this is, how will you select participants, what are you going to do to those participants, what sort of an intervention would you plan for these participants, what parameters would you study in these participants, what are the safety factors that you have taken into account to make sure that your participants are safe, and of course statistics, what sort of statistics would be used. And then we have participant rights and committees. So this constitutes a standard study protocol which should be there in all teaching hospitals. So you don't write because you want to say something. You write because you have something to say. And then when you have something to say, the shorter, the better. Okay, please remember, publication space comes at a premium. But then more importantly, the sort of time factor that the so-called attention time span of readers now is very finite. It comes at a premium. So you have to be short and concise. The letter to the editor, just saying that I read one particular article, it was very good, will not land you anywhere. When you write a letter to the editor about an article, that has to have something that will contribute to that particular article. Perhaps something that the authors had not stressed upon, or something they did not mention, or something that you still feel may not be appropriate. So the good old humble case report, Deepraj is actually going to speak about this in time to come. So I'll be very brief over here. Now, just because you have seen something rare does not constitute a case report. It should be something that has not been described before, or some sort of a presentation that is not usual. Maybe a new treatment, a new sort of modality of doing things, or something unique to a rare situation. That constitutes a case report. Now, the surgical technique beat, or like I said, this is also known as the how I do it technique. Now, in this bit, you can look at small portions of the operation. You don't have to, in fact, talk about the entire operation. You can talk about some bits of the operation that make the operation simpler, or you think it makes that part of the surgery safer or better for the patient in some way. So when you talk about surgical technique, and when you want to report about surgical technique, you can in fact just talk about one part of the surgical procedure as well. Please remember. So a case series then. Now, a case series, of course, constitutes a non-randomized observational study. And a case series basically follows a group of patients who have a similar diagnosis or undergo the same surgical procedure. Okay, very straightforward. For example, the initial experience with the ETP approach for large complex inguinal hernias. Now, when you talk about case series, you are basically talking about what you did and what you found. Out here in a case series, you can't compare one treatment with the other. You can just make some sort of general observations that you found in your case series. Okay, so be careful. There is you in fact need to be quite reserved about the conclusions that you can draw from a simple case series. Then comes the case control study, which is, like we saw again, a non-randomized observational study. Yes, sir.
I don't know if Dr. Goel has permitted. In the case series, of course, is wonderful, as you said, is no comparisons. But case series actually is a cross-sectional study. And nested case control model can be done in a case series. In your own case series, long historical cohort or a case series, you may have rendered two types of treatments. So within the case series, those two type of treatments, not as a trial situation, a nested case control study can be done, and odds ratio or can be calculated. That's all I wanted to say. Thank you.
Thank you, sir. Thank you.
Okay, so the case control study comes next, and when we talk about a case control study, what do we mean? When patients are selected once they have the target outcome or not, and researchers look backwards to try and find out factors of exposure. So what I mean is this: for example, incisional hernia rates following single incision laparoscopic cholecystectomy. Okay, so incisional hernia rates following single incision laparoscopic cholecystectomy. So you have, say, 100 patients that had undergone single incision laparoscopic cholecystectomy, and 10 of them now have an incisional hernia. So you can talk about those 10, the rest 90, and then try and look at factors that caused the incisional hernia. perhaps length of the incision, perhaps the manner of surgical closure, perhaps the sort of suture that was used, and so on and so forth. Then comes the cohort study, which is a non-randomized observational study yet again. Now, when we talk about a cohort, this means patients that have a certain similar characteristic. So a cohort study can happen when you have patients that are followed forward and assessed from the time of exposure until the time of consequences of exposure. And I'll tell you what I mean. So you have performed single incision laparoscopic cholecystectomy on, say, 100 patients. And you have then decided that you will follow up these patients for the next 1 year or for the next 2 years and look for primary endpoints and secondary endpoints. For example, incisional hernias, for example, bile duct injury, for example, other things. So that constitutes a cohort study. Then, of course, the randomized control trial. Now, randomized control trials are done basically when investigators want to assess treatment effects which they consider to be beneficial. For example, the laparoscopic group, the laparoscopic hernia group, say about 20 years ago, would want to prove that you have lower recurrence rates following laparoscopic hernioplasty than following Liechtenstein repair. And that can only be conclusively proved by a randomized control trial. Now, this is just a slide to tell you that as far as the cohort and the case control studies are concerned, they are susceptible to bias. And so they have limited validity for the simple reason that you don't have a randomized control group to compare your treatment results with. And that is why the randomized control trials are thought to be feasible and generalizable. So the advantages of a randomized control trial are, of course, that this constitutes level 1 evidence. It is useful to disprove efficacy. For example, the internal mammary artery used to be thought of as a very good graft to be used in a CABG, till it was proved in a randomized control trial that is not really the case. The orthopedic surgeons used to perform arthroscopies for arthritis. And that was again, found to be useless in a randomized control trial. But then there are problems with a randomized control trial too. There are in fact inherent problems about comparing surgical procedures. Surgical skill sets vary from one department to the other, from one hospital to the other, from one country to the other. Then blinding of the procedure from the assessor becomes very difficult at times, because the person who in fact reads the results should not know which arm this patient belongs to. And that can become quite difficult at times. There are times when there are ethical issues that in fact become involved. So you cannot perform randomized control trials in those sort of situations. So when we talk about the original articles, by and large, these can be in fact classified into three types: the retrospective studies, prospective studies, and retrospective analysis of prospectively collected data, the so-called retro-pro studies. And then we, of course, come to the reviews, but this is not this particular course will not touch much on the reviews because this talks about basic writing. But the narrative reviews are those that have more of an individual touch to them. These would be normally written by an expert who would in fact summarize recent literature and talk about new developments, but then from his personal perspective. The systematic reviews and the Cochrane reviews, they are much more rigorous compilations because you have very clearly defined search strategies. So these constitute some high quality reviews, in fact. So when you talk about systematic reviews, basically at the end of the day, you want to look at one specific clinical question. Okay, that is why you in fact collect several articles, look at them, and perform a critical appraisal, and then synthesize them together to try and find the answer to one specific clinical question. And the meta-analysis is a type of systematic review that again uses statistical methods to summarize findings from several articles and several analyses. And then finally, the editorials. This is again normally by invitation, where an expert talks about some personal beliefs about a specific research area. And the best editorials are short and pertinent. And this, in fact, brings me to another slide. Now, I'm no fan of Winston Churchill, but I sort of admire his wit. And he talks about a good speech, but the same thing, can be, in fact, substituted to a good, scientifically written surgical article. So it should be like a woman's skirt, he says. Long enough to cover the subject, but short enough to create interest. So I'm showing you this slide just to in fact bring you back to the point that you need to be short, you need to be concise, you need to be lucid, whatever you write. So again, this is what we have just looked at, starting from low levels of evidence going on to progressively higher levels of evidence. And this is the Oxford 2011 levels of evidence table, which is quite popular. That tells us that the level 1 evidence comes from meta-analysis, systematic reviews, and well-conducted randomized controlled trials. Level 2 is cohort studies or low-quality randomized controlled trials. Level 3 is case-controlled studies. Level 4 is case series, and level 5 is expert opinion. So to start with, what most people would suggest is you must start off, quite humbly. Take small steps for a start. So to start off, perhaps the case report, the case series, and the how I do it segment would be the one to target when you want to start writing surgical articles. The case series seems to be attractive because this can be done fairly quickly. This can be done retrospectively. And the case series just talks about what you did and what you found. There is no question of patient selection, of surgery selection, and this, that, and the other. But please remember, with a case series, you cannot compare two treatments to say one is better than the other, because like we had discussed, there is no control group in a case series. So the great leap of faith has to be taken for you to be on the other side and start producing some medical papers and publications. Thank you for your attention for this segment.
Thank you, Dr. Sharma. I think that it was very interesting to hear your presentations. I started publishing in last 10 years majorly. And one of the reason I love publishing is because I find when you write an article and you audit your results, it's like seeing a mirror. Till you don't audit your results, you don't realize, because you speak out what you remember. But when you go through your own data and you realize what is your mortality, what is your morbidity, and then suddenly you become quiet, because now you know where you stand. Earlier it was very easy to comment on others' results, but once you started, so one of the major benefits of writing is that you learn to keep data securely, which is a major concern with most of the surgeons in India who are not working in corporate hospitals. So I think thank you very much for emphasizing what are the different types of publications that one can do. Dr. Sandeep Kumar, would you like to comment on it? And then we'll take few questions. We have got a whole series of questions. Many of them are covering areas which will be discussed later today or tomorrow. So we are not going to take them. We'll just take the basic questions after Dr. Sandeep Kumar. Sir, you have to unmute yourself. Dr. Sandeep, please unmute yourself.
Let's take the questions. A brilliant talk by Dr. Anil Sharma. Thank you very much. You illustrated.
Thank you, sir.
Well. Just maybe a few things. Maybe I'll say it at the end of the discussion. So for the sake of time, let's continue with the questions, Dr. Goel. But very well done, sir.
Thank you.
Dr. Sharma, I think a good question is, I am a beginner, want to start to write good papers. How to begin? A beginner who wants to write good papers, and where should he begin?
Let Sandeep Aggarwal answer that.
Okay.
Okay, I think that's a good question, and that's what Dr. Anil Sharma said in his last slide. It's the best thing to start with the case report, because that's the simplest thing to write. Maybe not the easiest to publish, but to write, it's you need to have an interesting case. You need to have all the imaging, all the material, and you need to do a good review of literature, and you can quickly actually write in a day or two.
I think you said it, Sandeep. To write, you have to be a voracious reader. You've got to be reading. The subject on which you want to write gives you a kick that this is something that you've done, probably should be brought to the notice of the scientific community. Read about it. Read your textbook first. Read an undergraduate book. Read a postgraduate type of a book. And search the literature. It's on the internet. Read it and you will write it.
Okay. All right. We have another question. Basic question. Is ethical clearance required for observational studies? Dr. Sharma?
Yeah, certainly. Now, in fact, what has happened is that we have something in place which are known as the COPE guidelines. Okay? And journals throughout the world follow the COPE guidelines. The COPE stands for, in fact, the Committee on Publication Ethics. So they have a set of do's and don'ts which are, for all practical purposes, universally followed in most journals today. So there are very strong ethical sort of statements and issues that need to be followed when you in fact write scientifically. Very much so.
Okay. I think recently government also has made it much stricter that any study in India we should have an ethical committee approval for all the organizations.
I'll tell you why. See,
Yeah.
when you publish case series, I think what was the question, Raman? The question was, do we need
Studies.
for observational studies? So that's a very pointed question. Trial, everybody is sure, CTRI clearance, and you go for a trial and you register a trial, and unless you have a registered trial, you have a data monitoring board, etc., etc. Now, even a case report is an observational study, case series is an observational study, and a cohort may not be an observational study because although you're not intervening much, but you are observing them at successive intervals. So, who has the ownership on a historical case series? You come to the hospital, join as a young lecturer, or I join as a senior consultant, go to a corporate hospital, and I dig out the data from the electronic medical records or the physical record, and I start publishing it. So the ethic, since you are not disclosing the identity of the patients, majority of the time the patient may not come into litigation because it is not really affecting them. So, but somebody who has the ownership of data, maybe the hospital, maybe your predecessor, maybe some other senior or junior person. So that is the role of the ethical committee at that point in time. So why people have argued with me, why should I get an ethical clearance for an observational study? It proves, the ethical clearance proves your ownership on the data because you're not publishing an anonymous article, you're publishing it in your name.
Can I add something to that?
Yeah, sure.
Yeah, so there are a couple of other issues. One is the anonymity of data. So even if it's an observational study, you need to anonymize the data. That's a crucial part. And obviously, if you don't anonymize, then there is a possibility that patients' data might get, known to other people. So that's another aspect of an ethical clearance of an observational study.
Yeah, Dr. Sandeep, there is some change in ethical clearance requirement in UK. For many observational studies, they have a different set of parameter where ethical committee requirement is no more there. And those recommendations are actually coming to IAGS soon to recommend it to the government that probably in certain categories of studies we should actually waive off the ethical committee. So this is a challenge in India because a lot of nursing homes and surgeons who are moving from place to place, if they are operating in 4 hospitals, where do they get ethical committee approval and how do they get it?
So for all practical purposes, Raman, all major hospitals should have institutional review boards, and when they don't have these boards within their own premises, they can in fact take the services of boards that are present around, maybe from a large public teaching hospital, for example. So you have review boards available that can do your job, and that is something that needs to be gone through in today's day and world, like we'll see in the course ahead.
Okay, I'll take one more question. There are many questions. We'll be taking each of those questions at a later time today itself. So one question is that I am writing an article from my thesis, which I wrote for my PG. Can I extract more than one article from one thesis? And can the title of the article be different from the thesis topic? Dr. Sharma?
Yeah, so this is something known as salami slicing, as they say in the trade. And I think Deepraj will speak about this a little more in detail. But then if you have done a study, in your thesis that has for example, looked at 2 or 3 different but then related aspects, perhaps you can make 3 articles out of them subsequently. There is no problem like that. But then you have to be, certain that there is no sort of conflict of interest, in the sense that you have a separate authorization for each segment, of your study. But Sandeep, you want to add something? You're saying something?
I would say certainly no. Period. No, you can't do it. One thesis or postgraduate thesis, you can have only one paper because the study you have created is based on a single research question. And unlike a PhD dissertation, which lasts over 5 to 6 years, where it's a much bigger project which has many verticals to it. I would certainly say will absolutely abstain from slicing in, as you said, salami slicing. Don't do it. That's not taken kindly by the journals. It's considered a sort of a misconduct, and I would advise you against it. That's what I can say.
Let's try and define salami slicing. Say if you have a case series in your thesis of 1 year or 2 years of MD-DM thesis, and you have say 46 patients, or maybe you have 120 patients, and you've done 2 parameters, 2 molecular markers, and you want to publish both these molecular markers separately and correlate with the outcome, which may be survival or something, this is surely a salami slicing. Because it's the same cohort, it's the same case series. But if you have examined maybe as Dr. Sandeep Aggarwal says, in an exceptionally hard-working thesis during your MD or MS, and you've worked afterwards, and you have a separate epidemiological data and a separate molecular data, maybe it may not qualify for a salami slicing, and you may have this. So you really ask yourself, am I really making the 2 pieces of a cake, or I already baked 2 cases? So you just have to see.
Okay. Dr. Sharma, there is one more question which is more relevant to your second presentation. Can you please elaborate on the differences between systematic review and a meta-analysis? You briefly mentioned it, but probably somebody wants detail about this.
Yeah, so a systematic review, in fact, looks at several articles, to try and answer one clinical question. So there is actually a bit of an overlap between systematic reviews and meta-analysis because both of them look at several publications and try and condense and distill, one answer or 2 or 3 answers, but then pointed answers from several publications. That's all I can say. You have something to add, Sandeep?
Yeah. So I would say it is mostly right. I would say systematic reviews, meta-analysis, people either write a systematic review. That is what you look at the various studies. So if 5 studies says a technique supports a particular result, and 6 studies says doesn't support, so you all sort of give a balanced view. A meta-analysis comes in when you take the data also. So if you take the published data, so the meta-analysis can be from the published data, or you can call up the author to get the raw data. So it could be a raw data, analysis from the authors, all the authors, or it could be the published data you take from the tables, combine it, create your own means, standard deviations, results. So I think that a meta-analysis is definitely certainly more difficult, and certainly if there are lesser number of studies, it's futile to consider a meta-analysis. You need a good number of studies, good quality studies, especially RCTs, if preferably. And if you think you want to do a further complex thing, write an email to all the authors, get their raw data.
Combining data of homogeneous studies, drawing out your own odds ratios, hazards ratios is meta-analysis, and comparing studies, randomized trials is systematic review. So combining the data with new statistics is meta-analysis. Comparing data and comparing RCTs as per the protocol is systematic review.
Yeah, thank you, Dr. Sandeep Kumar. So I think before we quickly move on to the next topic of the day, but before I go to that, since there are many PGs here, I would like to announce that IAGS from this year has started 5 research project scholarships for PG students. So those who are doing research in minimal access surgery, 5 of them will be given a lakh of rupee. So you can make an application to IAGS with your research thesis, and they will be evaluated. Another thing that we have done this year is a best original research publication JMAS. So if you are publishing in JMAS at the end of the year, by end of December, we will evaluate which was the best original publication, and the author will be awarded for that in the initial conference. And there is another award called Best Researcher Award, which is for the seniors. So those surgeons who are in practice, in job, and who have multiple publications in any journal in the world, which are effective publications, they will be also awarded as the best researcher of the year. And so I thought this is an opportunity to announce this again. And we move on quickly to the next topic. That is by Professor Sandeep Aggarwal. Professor Sandeep Aggarwal is a professor of surgery in All India Institute, Delhi. And he is a prolific surgeon, does a lot of bariatric surgery, and has phenomenal number of publications to his credit. So he's going to talk on developing a research idea into an article. And Dr. Sandeep Aggarwal has also taken over as the editor of JMAS along with Dr. Anil Sharma. Sandeep.
Thank you, Dr. Goyal, for the introduction. And I would like to also thank Professor Sandeep Kumar for being a part of this course. This course was being run by Dr. Anil Sharma and Dr. Deepraj Bhandarkar earlier, and it is very nice of them for them to allowing me into this prestigious course and sharing my views. So I'll be talking about this. Can you see my screen, please?
Yes, Sandeep, we can see that.
Okay. So yeah, so I'll be talking about developing a research idea into an article. And when Dr. Anil Sharma gave me this topic, he told me not to go by the cliched things about writing an article like the HIMRAD or the other things, but just to talk about generally in a very, very simple language how to sort of go about starting a research. I mean, the topic itself is actually the whole workshop issue. I mean, it's obviously a huge topic, and I would like to touch the various aspects of writing in this presentation and not go into details which are being covered by various in the other subsequent topics. So once again, thank you, Dr. Goyal, Dr. Sandeep Kumar, Dr. Anil Sharma, and Dr. Bhandarkar for giving me this opportunity. So when you say convert a research idea into an article, we all know this is not rocket science. Dr. Anil Sharma has already talked about why we need to publish in this current era, not only for the academic surgeons, but for also surgeons in practice who are doing a good volume of surgery, for younger surgeons, for anybody who's interested in sharing their knowledge. So we certainly know anybody can do it. Anybody can dance. I mean, so it's not rocket science, but it's not child's play either. So writing is something people say, oh, he just hasn't got any job, he keeps writing. But it does take a whole lot of hard work, I can tell you. It requires persistence and self-belief. I can tell you from my own example, my first article got rejected by 3 journals before finally getting accepted in pediatric nephrology, which was a better journal than all the first 3 journals put together. And it was, the support from my mentor initially who said, no, this is a good report and it will be published. I think the foremost thing which it requires is honesty. Honesty as to the data, honesty as to the actual operative findings, the post-operative outcomes. And I believe there's no need to be dishonest in any aspect because you're not going to gain anything by being dishonest. Just say how things happen and what your data says, because it's very important. Because when you share your knowledge and with the world, this knowledge is going to be used by people. And if you say something false, it's only going to harm patients and somebody else's hand. And I would say a reasonable command over English language is, if not essential, is probably desirable. Although one can use professional help for correcting your manuscript, but I think the first draft, if you write it very badly, it's difficult to correct. And I keep telling it to my residents, if you don't write the first draft carefully, I will not give you the first authorship. So what is it like writing a scientific paper? I would say, in spite of its structured format, is still creating a story. I still like to call it creating a story, And I'll tell you why. And I'll talk about it in the subsequent slide. So there should be a flow in it. That's the most important part of this writing. You can't just have one ideas being, just being sort of floated and thrown around without having a connection to each other, or having a flow in the article. So what is this story about? Is starts with the conceptualizing the research idea, and I'll talk about it. Why I've put the second point in a bolder, in a different color and format is I think that's probably the most important part of writing an article, is the reading the relevant literature. Then comes the other parts: ethical clearance, the data collection, choosing an appropriate journal, organizing it into various sections, refining. And I will not really go into details of each of this, but just say what is required for each of these little sort of parts of writing an article. And when I say research quotient, we are talking about people who are practicing surgeons, or who are we're not going to design a prospective study. Here we are going to talk about somebody has seen an interesting case, they want to write a case report, or they do a good number of a particular surgeries and they want to do a retrospective analysis. So I'll be basically focusing this on those sort of, rather than designing a prospective study. This talk is not about, and this course is not about designing studies. So what is the main thing in research ideas? What do you want to say in your article? There has to be a loud message in your article, that you have to be very clear what you want to say in your article. What is it? What is a question, a concept you want to answer or what talk about? The primary outcome should be extremely, extremely clear. Otherwise, there's no point in writing a 3,000 word article and then say we don't have any message. So what editors look for is something new, something novel, or something original. And I can tell you, it's not something like which is like path-breaking research all in surgery you can do. That's more, goes for the basic sciences research where articles get published in Nature and other such journals. But we are basically looking at things which add a little more value to the existing knowledge on that subject. But whatever you say, you must have significant scientific value. It's not just enough to say that our results are a little improved, better than the reported results, or that's not good enough to say. And it must add to the existing knowledge. I'll give you an example from this is our recent publication. I'll give you an example from my recent publication because that's what I know the details about. So it's not to put my own publication before you, but just to discuss how we have done this. This was a study where we looked at outcomes after OAGB, and this study also included endoscopy at 1 year. And when we compiled the result, we did find that endoscopy we had a high rate of marginal ulcers. Now we could have, and it was not a huge number. It was I think about 68 cases. Now if you look at literature, it would be like people have reported hundreds and thousands of cases. But our message, we found a different thing. We found a high rate of marginal ulcer, which was not really reported from other studies because nobody did a surveillance endoscopy. So we sort of made that our primary, message for the article. Had we just said, okay, outcomes after OAGB in Indian population or something in a study of 68 cases, nobody would have looked at it. But once you have a message which makes a global impact, everybody sort of sits up and says, oh yeah, this study does very clearly say there are higher marginal ulcers. So that's what we need to say. Now, so what I mean to say is a research question needs to have a good single primary objective. You can have one or two more objectives, but it's better to have a single primary objective. If you're designing a study, the study is powered based on primary outcome. For example, I'll tell you, suppose you want to study the impact of double J stents in renal transplantation on urinary leaks. Now, obviously, you need to have leak as your primary outcome, not the urinary tract infection, which will also happen, but that can be a secondary outcome. And if you want to compare this with a non-stented group, you have to base your sample size calculation on this primary outcome of a urinary leak. And secondary questions objectives are less important and they are not powered. So your primary outcome should be very clear to you what you are going to study and answer. So does your research answer the research question you raised? No. So we're not going to talk about designing a study. Here we're going to talk about you've already done the research. So how does it answer the research question you raised? So when you describe the research, can your results support a conclusion with a greater global impact? So this is a study which we again recently published. This was an idea because this is again a retrospective analysis, and we were very worried by what is happening to our patients with liver cirrhosis. We are finding 5% rate of cirrhosis in our bariatric surgery population, and we want to know exactly, as Dr. Raman said, one offhand you will say, okay, everything is good or everything is bad. But if you have to look at it objectively, so when we said this is in the introduction, this study aims to evaluate the safety and outcome of metabolic and bariatric surgery in severely obese patients with advanced liver fibrosis. And we have to, our results should say, answer this question, whether it's safe and what are the outcomes. So in conclusion, we say metabolic surgery may be safely performed in well-optimized cirrhotic patients or patients with advanced fibrosis and has a potential to ameliorate NAFLD-related cirrhosis in a subset of patients. So we have actually answered our question. So unless you do that, you may write anything and you will just come out with some vague conclusion. It could be a negative conclusion. You could have said, okay, metabolic surgery is not safe. That's also good enough. But one should have a clear-cut answer to what you're saying. This is a mistake we made recently. Again, from a personal example, we decided we'll study the RYG outcomes in our own population. But we analyzed the data, we collected everything from our database. But a sample size of 200 odd cases is not good enough for an article on RYGB outcomes. And there's several articles, thousands of patients. No journal, no good journal will even have a look at it. And although we may personally benefit by knowing our own outcomes, as Dr. Raman said, it was difficult to write a publishable article which will add to any substantial knowledge. Maybe it will get set in a local journal where Indian data may matter. But I think we made the mistake of not defining the purpose or the research question before, starting this analysis. So this is what I'm saying. So you must have what you want to say, one clear question before you start your study. This is thing I was talking about. These are the things which are talked about, and I will not again go into detail as these will be covered in the subsequent lectures. These are the general guidelines of how to formulate a research question that you talk about population of interest, PCOT format, intervention, I stand for intervention, C for a comparator or a control group, or outcomes which need to be evaluated, and T is the time duration. So if you look at this topic, one can have a simple question like, so can surgery cure diabetes? Or you can have a more structured question, can intensive medical therapy plus bariatric surgery, these are the two groups, okay? So comparator group and the intervention, reduce HbA1c, which is the outcome, after 12 months, which is the time duration, obese patients, which is the population, obese patient with uncontrollable type 2 diabetes, that is a defined population, compared to intensive medical therapy alone. So intensive medical therapy is the comparator. So if you go back again, if you see, look at this question, it certainly looks better than the question, this simple question that surgery cure diabetes. So we need to have this sort of clarity in our mind when we start collecting data or start reporting data, if you want your article to be published. Look at this again. So again, bariatric surgery, this is a paper published, very often quoted, very popular paper in bariatric surgical circles, published in NEJM, obviously a very high quality journal. Bariatric surgery versus intensive medical therapy. So intervention versus comparative group in obese patients with diabetes. This is a target, or this is a population to be studied. Now, if you look at case report, now most of the journals are flooded with case reports. They are most difficult to get published in good journals. And although it's easier to write, but most surgical journals have stopped taking a case report. But still, it's a good way to start. And as Dr. Anil had stressed, what is the novelty of the case you want to study? It could be a novel technique. For example, look at this transperitoneal transmesocholic approach for laparoscopic excision and extrarenal pheochromocytoma. I mean, if you do a lit search, it's obviously very little to you'll find. So this is obviously a novel technique. A rare pathology, a rare complication, a phrenic nerve palsy, in rare complication of indwelling subclavian catheter. So when we wrote it, we didn't know actually, and we did a lit search. It was really rare. So it is you have to have a unique thing to write about. So what we think is novel may not be as unique once you do a lit search. For example, if people sometimes come across a foreign body and this thing is very interesting to write. Yes, it can be. So if you take this example of a laparoscopic removal and intra-abdominal foreign body, let's do a lit search. put foreign body and laparoscopic word, just that, you have 637 results. And if you put foreign body and laparoscopic word, it gives more than 1,000, you know, results. So obviously this is not rare, but some of us would like to think that it's rare and would like to write it, and then we send it for publication. It's rejected by most journals. But don't get disheartened. I would still say we do come across in our career, long career, from time to time, interesting cases. And my suggestion to you is anytime you come across an interesting, you do a quick PubMed research. Recently, we had a case of a breast aspergilloma in the ward, bilateral. And though it's not my interest area, just ask the resident, have you done a Google search or PubMed search? They said no. Go and do a Google search. And not only did it help in finding it's a rare thing, the bilateral breast carcinoma, they also read about the treatment, and they came out with how long the antifungal treatment should be continued. And obviously asked him, please go get in touch with the consultant who's looking after this case and write it or follow it up. So do not ignore an interesting case. So do a PubMed search. If it's rare, go about writing it. Be sure about its novelty. Find a journal first which accepts the case reports. But make sure that you have all the imaging, because without imaging, a case report is useless. Specimen pictures, histopathology pictures if applicable. You cannot be reporting on hemangiopericytoma of renal pelvis without having a histopathological picture. And I think the most important aspect of case report is that you should teach comprehensively about that particular case with respect to literature. That means you should have done, supposing there are 15 case reports published in that particular rarity, you should have actually read all those 15 articles, probably make a table of all those articles based on clinical presentation, treatment, outcomes. That would add much more value to a case report. I have seen case reports which are very nice, but when it comes to discussion, the author has not done and not put in the hard work it requires. So you need to take out all those articles. If you say thing is rare, obviously it can't be 200 articles. It could be just 10, 15, 20. Take them out. Do a good analysis, make a table, and see what is different in those. Unless you discuss the differences of the management, the presentation especially. So if there are 20 cases of the same rarity, how do they present commonly? So this is an important part which a lot of researchers or the writers neglect while writing a case report. So this is a good quote I found somewhere, which from one of the physicists of the 20th century. The measure of greatness in a scientific idea is the extent to which stimulates thought and opens up new lines of research. Because when you read up an article, it should stimulate you. It should stimulate you. It should give you a good idea of what is existing, what needs to be done in future, and it should enhance your knowledge. You should feel good after reading an article. It's not be seen as wastage of time. So next, I'll come to the what I personally consider is more important than probably a research question, because this is what a lot of people make shortcuts. Is the literature review, and I'll tell you why. The literature review is very essential. A thorough literature review, not going through the abstracts. Not you have to go through the full articles. There's no shortcuts to that. What it teaches us is what is already known, and then what is the gap in evidence, and what are the limitations of previous studies. I'll show you an example. So this example, look at this example. This is a introduction from one of our published papers. Just see how it's very concise. It's probably 1.5 paragraphs, or maybe when you put it in this thing. So what is known? So morbidly obese patients have an increased prevalence of reflux symptoms with esophagitis. Okay. So this is what is known, and we give references to each year. What is the gap? Gap is we do not know. There's paucity of prospective studies which have analyzed the problem of GERD after sleeve gastrectomy as a primary endpoint. There are a lot of case series and a lot of articles which will casually say, okay, GERD increases or GERD decreases, but primary endpoint, there are very few studies. And why do we care? We care because sleeve gastrectomy as its own is a very good operation, good weight loss, good metabolic effects, and we do not want to just on the basis of not knowing something. We either criticize it unknowingly or praise it unknowingly, and how do we want to fill this gap? Is to to do a study, precise study with GERD as outcome using some investigation. So literature review helps us in exactly defining what is known, what is the knowledge gap, and editors or journalists want to know. This is the introduction where you reflect whether you've seen the literature properly or not. But mind you, this is you should not really start your introduction, and I'm sure Dr. Anil will talk about it later. Introduction should not be very big. It should be very clearly divided into what is known and knowledge gap, and that can be done only if you have done a good review of literature. Another example. This was an excellent, protocol which I came across. Beautifully written, randomized control trial, and that's why I kept it as a, this thing for a teaching purpose. So look at this. Now, had the authors not done a good search, they would not have found that although there's an existing randomized trial, the comparative group was saline irrigation, which was probably not a good thing. So they said, although this trial has shown promising results, the study is limited by its comparator arm of saline irrigation. A more rational approach would have been a head-to-head comparison of intravesical gemcitabine and with other chemotherapeutic agents. So this is the limitation of the previous study I was talking about. So if you do a good literature search, you know what mistakes other studies have made, and we want to correct that in your current study. And so based on this, they could say till date, no randomized trial is available comparing this chemotherapy with this chemotherapy. And that's how this study becomes unique. So when they write it, again, this will clearly shows a unique thing. Original work has something to say. And again, Dr. Bhandarkar has a talk on this, how to do a literature review. It's an important part, and then there are various tools. I will not go through that. There are YouTube videos, and I'm sure Dr. Bhandarkar will cover all that. So before
Sandeep, I think we have lost you. Pushpendu, are you able to hear him?
We aren't able to hear him.
No, so I think there's a break in the connection. So as he restores his internet, we can probably take questions in the meanwhile. And yeah. So Dr. Kritika, you can get it checked about his internet connectivity. So Dr. Sharma, there is a question on, I'm willing to write a paper on breast sepsis converting into carcinoma breast. So please guide me how to proceed. I think Dr. Sandeep Aggarwal was discussing this, that if you read it on literature, that how many breast sepsises are ultimately are found to be malignant, you will know how rare or how common it is, and then you can evaluate your own. Sandeep, are you?
Can you see me now? Sorry about that.
Please go ahead.
Okay. So where were we? Could you get me here?
No. Yeah, you were there on a literature review. Yes.
Yeah. No. So were we? Had we gone through the slide? Could you hear me there?
Yes.
Gone through the
Okay. So as I said, Dr. Bhandarkar will talk on the subsequent lecture about how to do a good literature review. So what my suggestion is, while you're conceptualizing a research question, or just before that, or just after that, you should do a thorough review of literature. There are no shortcuts to it. Take out at least 5 good articles related to your idea, propose research, but don't limit yourself to just review articles. One of the common things I found with my junior colleagues is they take out one research article, go through it, and just want to write a proposal. Read word by word, highlight the important points, make notes, read the discussion section most carefully. That's where you find the problems of those studies which have already been done. Look at the cross references, then take out another 5 articles. And make your folder right in the beginning. So this is how I'll advise you. This is a chapter I'm writing, or let's say we're writing on an article on marginal ulcers. We take out whatever articles, there's about roughly more than 10 articles. We read them through it. Sometimes we can share between our colleagues, but I would suggest do it yourself if you are the primary writer of the manuscript. It's a hard work. One article may take about half 1 hour to 1 hour, but if you become used to reading good articles, you know what to skip and what to read. But I would in initial stage advise you to read word by word, make notes of what is important from these articles, because it's very difficult to remember which article said what. Make notes. After you've done this, apply for an ethical clearance early. As we said, any study, retrospective or prospective, observational or interventional, can start only after an ethical clearance. I will not go into details of ethical clearance, ethical issues here, and will be covered subsequently. The next step before you write the article is to choose a journal. Some people choose a journal after the article, looking at the quality of the article. That's fair. But I think the beginning, it's good to choose your journal where you want to write, publish it. You don't want to write an article and then you have to do a lot of hard work readjusting the reference styles, the reference quote. How do you quote the reference in the article, whether it's a superscript or in the brackets, and that becomes a lot of tedious, work. Although there are softwares to help in that, but I would say look at the journal. So what do you look at? Look at their article processing times. Suppose you are a postgraduate who have finished a thesis, you want a quick publication, may not be a very high impact journal because you want a job or a senior agency. Go for a journal which has a shorter article processing time. Look at the type of articles. Look at the impact factor. If you are not, if you think your article is of good quality, you want in a higher impact journal, look at that. Another important thing is whether open access or not, or hybrid journal. But remember, all open access journals charge a fee unless your institution has subscribed to that portal. Whether the review is blinded or not, it matter in some cases. Once you have decided, read about the about us section of the for the scope of the journals and the instructions to the author section carefully. Don't ignore it, okay? Because once you've decided, read thoroughly. Read some articles or several articles of the journal. That gives you an idea, what is the journal expecting, what sort of articles are getting accepted. There are certain tools available like Journal Finder or Springer Journal Suggester, but I think with experience you come to know which journal is good for you. For example, I'll go from, because I'm a bariatric surgeon, I'll give you an example. This is one of the top-notch journals, ranked 7th in all the surgical journals. So unless you read an article on psychological something after obesity with no surgical intervention. Now, this journal clearly says we see publications of peer-reviewed manuscript of highest quality with objective data regarding techniques for the treatment of severe obesity. Article document the effect of surgically induced weight loss on obesity. So if you have an article which is not really dealing with bariatric surgery or some sort of intervention, they will not take your article. It will be a waste of time. You will format it according to the journal, send it, and they will reject it straight away at the editorial level. But you have a different journal like clinical obesity. So now you look at its scope. Key areas of interest are, so it is a much broader area for obesity people, physicians who are dealing in obesity, the psychologists, the paramedics, all that, they can send their articles here. So you need to know which journal to send. This is our own journal, JMAS. So if you want, so it shows you what are the types of articles it will accept: leading articles, reviews, original articles, and it will give you some detail of what it sort of is expecting. Unusual cases, how I do it differently, troubleshooting. So each journal gives you, and it's extremely important to have a look at what are the types of manuscript they are going to take. Now, if you want to, so this is an obesity surgery journal, which is the second, highest ranked journal in obesity surgery. And I think one of the most attractive points about this journal is their time for submission. So submission to first decision is just 1 month, which is extremely, extremely fast going by publishing standards, and it still has a good impact factor of 3.4. So you have to look at several factors when you are looking at choosing a journal, and there are many others, but these are the few more important things which you are looking at. But one thing I must sort of caution you is beware of predatory journals. There are a number of journals. Every day you get emails soliciting articles which have, if you publish, have no value. They are actually counterproductive, because if you go for an academic job and if you put in your CV a journal article which has been published in a predatory journal, it's a negative, big negative for you. They charge exorbitant publication fees. They do not provide any services associated with legitimate journals, and they use false impact factors. And I'm sure all of you have seen these emails. So when it comes to actual writing now, I would say decide on authorship. There are multiple authors. It will avoid conflict later on, especially the order of authorship. I have burned my fingers myself. Sometimes the person who's done the research and the person who's writing it may be different, and they both qualified to be actually the first author because they have put in equal amount of hard work So it's probably at the outset, it's better to define who's going to be the first author and the second author. You might change depending if the person is not put enough work. This is all I always tell my residents or colleagues. If you've not put in good work, cannot be among the first few authors. And there are guidelines on authorship about clear-cut criteria for authorship, which are useful to go through. And one thing you must remember, this is recently as I came across some requests like that, a change of order of authors or authorship after manuscript is accepted is not usually seen in good light. It's not the done thing. And this is a quote from Sword. That only in exceptional circumstances will the editor consider the addition, deletion, or rearrangement of authors after the manuscript has been accepted. So while the editor considers the request, the publication of the manuscript will be suspended. So it's a big nuisance to change author. It's not a good thing to do. And authorship should be limited to those who have made a significant contribution to the concept, design, execution, or interpretation of the reported study. And there are various websites you can go through to get this. And how to now actually write an article? This IMRAT format is what is given in all the journals, and I don't think anything goes beyond. Is there's anything different? And I'm sure Dr. Anil Sharma is going to go in detail when he talks about the principles of writing. But broadly, it talks about why the research, what and how we have done it, what was found, and the discussion is it answers the research question. Your discussion should clearly answer the question you raised in introduction. And I will be surprised how many people fail to do so. They just repeat the introduction, they repeat the results in discussion, they are going to lateral thing describing obesity epidemiology and all that. So and describing a particular operative technique. And so the discussion is basically answering the research question and discussing it with respect to the other studies which are reported on this. So just to summarize my talk, a good scientific writing, as I said initially, is like creating a story. It may have a structured format, but still it's a story. So you have to create a logical flow from one idea to the next. Demands clarity and precision, as Dr. Anil said, and short. Reduce wordiness. So whenever I get a manuscript from my colleague to check and go through, I decrease the number of words by at least 20%, 10 to 20%, because there's so much of unnecessary words being used to describe a thing which can be described in 10 words. Somebody will use, and it all comes with experience. I can tell you, even if once I've gone through that, somebody senior looks at it, he may further reduce it. This comes with experience, so there's no nothing to feel bad about if some senior person is reducing the number of words or correcting your sentences. So, but reduce wordiness, because that's a premium, the number of words, especially in a case report. Be concise. Avoid long sentences. You can get lost. Just put simple, short sentences. Put a full stop, start another sentence. There's no need to put semicolon, colon, and brackets and hyphen and keep going on till the cows come home. So we can't, and it sort of creates so much of confusion. Impressions and guesswork should be avoided. I'll tell you one example. So one of the recent paper I reviewed, the author said the definitions of weight regain after bariatric surgery remain obscure. Now, that's obviously an incorrect statement. There are very precise definitions. There may be multiple definitions, but they're definitely not obscure. So they don't just say anything, just because you just you just sort of heard it in your mind. These are just impressions. They're not backed by literature. And any guesswork should be avoided in a scientific writing. Any important statement that is not the direct result of a study should have a reference. Remember that. Don't make any reference. Okay, let's say a laparoscopic gastric banding is the most popular revisional bariatric surgical procedure. Now, if you don't back it by a reference, you should not put that statement. Okay, so any important statement, use a reference. Follow the instruction to the author strictly by word. There are checklists. Go by that. But at the end of it, what is important is to be honest. Honest to yourself, honest to your colleagues, honest to what you write, and that would take you further in scientific writing. Thank you so much. Happy writing, and I hope this course gives you the much needed impetus and sort of a broad outline of how to start writing. Thank you so much for your patient listening.
Thank you, Sandeep. So I think this was a very informative talk, giving an overview of right from research question to publication. and we are going to cover different aspects of his presentation in different topics. So we have a long list of questions, but probably we'll take them at the end so that we make up some time. Dr. Sandeep Kumar, sir, would you like to have any observation before we move on? You will have to unmute yourself.
Brilliant as usual, as expected from Sandeep. I think he's covered all aspects. Since we are getting late and I must leave at around 6:15, so I think I would let next call, talk by Dr. Deepraj.
So, yeah, friends, so our next speaker is Dr. Deepraj Bhandarkar. I'm sure everybody in India knows him well. Dr. Deepraj Bhandarkar is the founder, editor of JMAS, who single-handedly brought it up to a level there where it has the best impact factor among the surgical journals in India. And at the moment, he's the chief editorial advisor of JMAS after handing over the reins to our new editorial team. So Deepraj, welcome back on JMAS activity. And the topic he's going to talk about is the literature search, the beginning.
Thank you, Raman. I think it was a very interesting presentation by Sandeep. Am I well audible?
Yes.
Okay, thank you. So I'm going to take this one step further, and what we're going to look at is, I'm actually going to get my headphones off. So what we're going to look at here is the first step when one decides to write an article. And that starts with, naturally, the first step is an idea for a research, for a topic, or for, as somebody said, you've seen an interesting pathology and you want to write this up as a case report. So the first thing naturally is the idea or the desire to write. The next step after that is a thorough literature search. And Dr. Sandeep has touched upon it slightly, but we will take this further and look at it in greater detail. I have no disclosures for this talk. And when we talk about literature review before writing an article, this is the quote that always comes to mind from Abraham Lincoln. What he said was, if I had 6 hours to chop down a tree, I would spend first 4 hours sharpening the axe. And it is very pertinent when it comes to the literature search, and the time spent in researching a topic should be almost half of that, if not more, of what one would actually spend in writing and rewriting that article. Because unless you have done a thorough literature search and understood the topic well enough, it is not possible for you to write a good article. So we will touch upon these aspects of literature search. What exactly is it? Why is it necessary? How does one do it? So we'll actually see some practical tips on how does one do the literature search. What are the sources to look up for this? And most importantly, how does one obtain the reprints or the full text article? Because it's not adequate to just read the abstract or sometimes extended abstract, but one needs to have access to the reprints or full text PDF file to be able to draw a meaningful conclusion from reading these papers. So literature search is essentially the search for and reading of all published research on a given problem or a question. So as we said, we start first with the question or the research question and then embark on this next step. Next, we come to why is it important to search the literature. Fundamentally, we must understand that anything that we write today has probably already been written about or has already been touched upon in the literature somewhere. So it is important not to duplicate the research. Some of the cases, some of the aspects that you feel may be very interesting, if there is enough literature on it already in the surgical sciences, there is little chance that it will get published. And that's why it's probably not worth spending time and effort on writing that paper up in the first place. it also gives you an overview of what has already been studied and published. You may always have a slightly different take or a slightly different research question in mind, but if you start by assimilating what is already said, it's easier to formulate that question in a way that it can then stand a better chance of getting published as a paper. In any paper, one of the important sections in the discussion part of a paper is actually comparing and contrasting your results with what has been said or what has been already published. And that's why having a good grasp of the literature of the previously written papers is important, so that you can compare and contrast your findings, your data, your analysis with what is there in the literature. So how does one do a literature search? Now let's get down to the nitty-gritty of it. So first, identify the topic and the preliminary research question. So this is an hypothetical question, and we will work with that and see how does one do a literature search based on, say, this topic. So the question that we are posing for ourselves is, does the timing of laparoscopic cholecystectomy during acute cholecystitis influence the rate of complications? Now, that first topic may be too broad a topic to form a sensible topic for a paper. Complications is a broad word. Do we really mean, does it affect or influence the rate of bile duct injury? That may be more pertinent and that may be easier to search. So how does one use the PubMed? What are the search strategies that we use? What are the filters that we use? And how does one get full text reprint? We're not going to go into the details of the PubMed. PubMed is a vast resource, and it's far easier to actually go to the PubMed site and go through their question answer page to see what are the strategies and getting the best out of it. Also, as Sandeep showed in one of the slides, there are several videos on YouTube which you can access, which tell you in detail what strategies to use when accessing PubMed and looking for literature. So let's take an example of this topic, and we laparoscopic cholecystectomy, acute cholecystitis, and complications in the PubMed box. If you look at the number there, this has thrown up nearly 1,300 papers. Now, that is a vast number of papers. It's not physically possible to access those papers or to go through them in a practical way. So let us actually narrow this down to laparoscopic cholecystectomy and bile duct injury. The number immediately comes down to 210. Now, at the first instance, you may not want to read each and every one of these articles, but what you would do as a preliminary introduction to that topic, you would want about anywhere between 10 to 20 good quality papers. As Sandeep emphasized, it's not important only to read the review articles, but if there have been original articles reporting series of bile duct injuries in the setting of acute cholecystitis and laparoscopic cholecystectomy, you must read at least a few of them to give you a feel for what the current knowledge or current body of knowledge of literature on this subject is. So let us now narrow this down. If we put this in parenthesis, so if we say laparoscopic cholecystectomy, acute cholecystitis and bile duct injury in parenthesis, this tells the PubMed or the search engine that you're looking specifically for articles which contain all these three phases. And this, as you can see, narrows down the search to about 129. Again, too big a number to do your primary search on. Now, if you go to the left side and click on this filter which says review, it will bring up only 18 articles. So that is probably a good place to start initially. But as I said, at some stage, once you have enough knowledge, once you start reading these review articles, each of those review articles would have put tapes which you can go and track and access and look through. So that is the strategy that one uses for searching and researching the literature. Now, most important is you need access to something that can be downloaded and read easily. So if you again activate this filter which says free full text, it gives you 2 articles which are free for you to download. So these are the open access articles. So this, to my mind, would make a good starting point for a research like this when you just get a feel for it. By no means this is adequate or this is extensive, but this would start a good reading for you. Each of these review articles would probably be about 10 to 12 pages and would be comparatively exhaustive, that they give you a feel for the subject as to what has already been said or what is being done already. The next step is to go to Google. It is amazing how many articles which sometimes do not show up on the first page or first 2 pages of a PubMed search come up very easily on Google. There are certain PDF engines, ResearchGate, I'm going to talk about it a little bit, and actually getting some of these reprints by requesting the authors directly for it. So let us look at Google. Now, if you simply put this laparoscopic cholecystectomy and acute cholecystitis and bile duct injury in Google, you will come up with several. I mean, it says that it shows you something like 120,000 searches. I mean, that's not a practical number by any chance, but it tells you what are the, if you go to the setting and tools and if you say articles or searches in the last, say, 5 years, it will immediately narrow them down to what has been written recently about this topic. In all likelihood, that paper or that review would have researched or would have taken into account what was written prior to that. So that way you can get some more articles that you want to look for. So this is a filter. You say past year, or there is a custom range. You can say 5 years, and it easily brings up the articles on the subject. There are some specialized PDF search engines. Now, these articles can be scattered anywhere on the net. They need not only be on the journal website. They could be on the author's website. They could be in several other places. And if you use one of these PDF search engines, so just put in PDF Finder in Google and you will come up with several of these PDF search engines which give you access to the full text articles for you to download and read. So this will allow you to look for those articles. So this is one example, pdfsearchengine.org. You just need to put in the, so here you do not put in the keywords. You need to be able to put in the title of the paper, because that is how this will search. It will not search only by, so this is not like Google that it will search by the keywords that you put in. You need to copy paste the title of the article into this, and if there is a PDF or a free to download PDF available somewhere, this would find it for you and you will be able to then download and look for it. ResearchGate is a platform where those surgeons or those clinicians who are active academically and publish, they put up their articles, or they put up the reprints of the article, or at least the title and abstract of the article on this website. Now, for example, this is Dr. Anil Sharma's research page. So the address is researchgate.net. And if you open it and if you put the name of the author that you're looking for in this search engine, you will come up with his article. So this is an old page. Dr. Sharma at that time had 117 research articles, out of which 106 were articles. There was one book and several book chapters. So you should be able to go down this list and look for the articles that you were looking for. On ResearchGate, there is a link to say full text available for download. So some of the articles which Dr. Sharma would have uploaded in its full text format would be easily available for download just with a click button. If not, you can always request the author to send you the full text. So there will be a link. If the full text is not available, there will be a button which said request full text. So if you click on that, an email will get sent to Dr. Sharma automatically, suggesting or indicating that such and such person is interested in accessing an article that he has written. And more often than not, the authors who put up these articles, those who are academic, would be happy to share their research with you. So that's the button that you would click on, request full text, and you would get articles. Sometimes all these methods do not easily work, and you have to rely on getting the reprints of an article directly from the author who has written it. So how does one go about it? Now, again, going back to our example of PubMed, you need the authors or the first authors or the senior author email so that you can write a polite email to them requesting requesting that article for you. So this was a patient that we were managing, that this lady had Cushing's adenoma during pregnancy. And the question was, what should be the ideal strategy for this? Do we perform adrenalectomy during the second trimester? Do we wait? So this was the article that, after searching a lot, I came through that this was a case report with review of literature. And the PubMed had only the abstract. There was no easy way of my getting access to this particular European gynecology journal. So today PubMed has done a peculiar thing that they hide the author information under this tab. Previously, the author's institution, the email, etc. used to be displayed. But today, for some reason, for the last 2 years, they've started hiding it. But if you click on it, you get the author's email here. So what I did was I simply wrote a polite email to this author explaining why I needed access to his paper. That my endocrinologist colleague is currently looking after a patient with Cushing syndrome detected during the second trimester, and the patient is being considered for an adrenalectomy. That therefore, I would like to have access to your paper to read about what is the thought process on this currently in the literature, because this is an uncommon scenario. And trust me, when you send a request such as this to an author who has published something, it's not uncommon or it's natural for the author to feel flattered, and most of them would within 24 to 48 hours oblige you by sending you a PDF reprint of the paper. So this is one way of very easily getting a reprint from the author himself. Sometimes the author information is not very easy to find. This very old paper, 1996, written by Michael Eadie and Barry Salke. At the time, both of them used to work at Mount Sinai. And this actually is a landmark paper in the literature on paraesophageal hernias. What they postulated was excision of the sac during a laparoscopic paraesophageal hernia repair is essential to prevent a recurrence. So this was the first time that this thought was put forward, and they had a series of cases to support that idea. But again, old issue of surgical endoscopy, not easy to find, not easy to get access to this. If you click on author information, none of the author's email appears there. Maybe in 96, it was not customary for them to put the email in the author information. So this is where the detective inside you should come forth, and you can do a little bit of digging around to find at least one of the author's email. So we know that from this paper that this paper was published from Mount Sinai Medical Center. So we can go to and this is true, and I have done this several times, particularly the American hospitals have easy access to the doctors, the clinicians' email on their website. The Europeans are not so particular about it. Obviously, this usually is an email which is a professional or a hospital email, and it's hardly ever a personal email. So let's look at the doctors on this Mount Sinai Hospital website, and we can see that Michael Eadie is here. Barry Salke is also here. So if you click on Michael Eadie, it will take you to his page, which gives his brief biodata, and this is his hospital's email, michael.ed@mountsinai.org. So you can easily capture this from this point and then write an email to him saying that you require or you request him to send a reprint of his article. And he, most often, as I said, the authors would be more than happy to share it with you. I'm going to briefly talk about this. I just got one slide. Dr. Sandeep emphasized on this. Getting lots of reprints and keeping them in a folder is never enough. You actually have to read them and synthesize or assimilate them. And there are various ways of doing them. What I find easiest to do is to read from the first word to the last word each paper. I usually read them on a computer in a PDF format. I also highlight in yellow or in green the text which I feel I may want to refer to when I'm writing an article. But at the same time, I find it useful to have a Word document open in parallelly side by side. And so I would start by writing the title of the paper on top on a page, the authors and the exact citation, and some of the ideas from that paper which I feel are going to be useful for me to quote or refer to in my paper, I would jot them down on that page. Next article, a new page, and the same thing again. So if you read, say, 30, 40, 50 articles for a topic, you would have a big fat file, a Word document of about 40 or 50 or even more pages, which will easily give you at a glance all the ideas that you need to refer to when writing the paper. Mind you, it's never a good idea to simply copy-paste sentences or ideas from any paper into your article, even by referencing them. That is just not done. That's plain and simple plagiarism. So one needs to be extremely careful in avoiding that. It always needs to be paraphrased, or better still, you need to the idea and express it in your words. But this method of reading the articles and summarizing them then gives you the possibility that you then have to go only through that one document file rather than going back and forth to multiple PDFs looking for ideas which you felt were important and that you wanted to quote in your paper. So this is what I find useful. There are now several sort of app or softwares for doing this. I simply like to use this system because I have used this for years and it works well for me. These are some of the resources I have put down on this last slide. That these are resources about how to intelligently search the literature. So the first one is actually, this is an excellent series. So if you go to the Singapore Medical Journal, this was I think about 2002 or 2003. They had carried a series of about 10 or 12 articles on medical writing. So one of them was on literature search. So this is the URL for that. But if you go to that year's Singapore Medical Journal, and these are all full text free articles for you to download. It's an excellent series of 10 to 12 articles on how to write a paper. The second one is from the NLM website, which is the PubMed body that runs, and they have some, tutorials there which tell you how to use the PubMed sensibly. And the rest of them are certain resources which you will find useful. So thank you very much, and I appreciate your listening in.
Thank you, Deepraj. I think that was very elaborate and self-explanatory. I'm sure people would find it very useful when they're doing a search, because search is such an important component of literature search, and one feels handicapped because one may not know the exact way to do it. And I think you're giving great tips to each one of us. I think what we can do, Deepraj, if you are agreeable, that we can continue with the talks, and then because there are many questions which are overlapping between different speakers.
No, absolutely. Let's go ahead with the talks.
So I think the hardcore thing starts now. How to write, the principles by Dr. Anil Sharma again. Dr. Sharma, Are you ready with your presentation?
Yes, thank you, Raman. Let me just share my screen first of all.
Yeah.
And then get to my presentation, which is this one. Right. Okay. So can you see the slide?
Yes.
Right. So, okay, well, thank you, Deepraj and Sandeep. That were great contributions. We've been all contributing together for this course for a long time now, and we hope to be continuing this in times to come. So my job here is to speak on the principles of how to write. So the great man himself said, if you can't explain it simply, you don't understand it well enough. So the point here is to put your message across simply and concisely and lucidly. So when you want to go for a long drive, you will not just jump into your car and start driving. You will have a roadmap, you will make a plan, and then start to drive. So we guys here, the subcontinent specifically, there is a term that is known as jugaad, and we are very adept at it. It's a way of innovating, of trying to improvise to get work done. And you have several examples of this, in our day-to-day life across our cities and towns and villages. But in medical writing, unfortunately, we are very formal. There is a format in place, and this needs to be followed all the time. And we have talked about this format, which is the IMRAD format, and this means that, as we know, introduction, the methods, the results, and finally discussion. But if you look at the entire structure of an article, this is what it constitutes: the title, the abstract, the keywords, the IMRAD, and finally conclusion and references. This is one complete article for you. So for original articles, this is how things normally play out. Okay, there are no sort of no very hard and fast rules, but then normally this is how things play out. The introduction, normally 2 paragraphs, 5 paragraphs of methods, normally 7 paragraphs of results, and 6 paragraphs of discussion. So there are 20 units of thought to prepare for an article. Okay? Now, why I am saying this is that you have to in fact consider your article to be 20 units of thought. And these 20 units of thought need to be addressed 1 unit at a time. So let's try and do that. Now, the first 2 units of thought in the introduction, which is why did we start? Okay, that is your segment on the introduction. So like Sandeep said, some time ago, the first paragraph is what is the current knowledge on the subject? And like, Deepraj has been saying, Prof. Sandeep Kumar said, Prof. Sandeep Aggarwal said, Raman also mentioned, till you have read and you know what is the current knowledge, you can't start, obviously. So your first paragraph just talks about what is the current knowledge on the subject that you are dealing with. The second paragraph derives from the first paragraph. The second paragraph picks up something that may be in fact considered to be a lacuna, that may be something that has not been addressed properly, maybe something that needs a little clarification from what is known already. And that is why you did your study. So the last sentence of the second paragraph normally would appear like this. The aim of the study was so and so, or we report so and so, we repute so and so. 2 paragraphs of introduction. Now, the second segment, the next segment is that on the methods. When we talk about methods, please remember we are just talking about what did we do. The story of what the authors did, which should appear in a logical framework of time. So we first sought approval from the ethics board. We selected our patients. We made 2 groups. We did this particular intervention, and then these are the things we had measured. Okay, so a logical framework of time, just like a story. And please be clear about your primary endpoint and secondary endpoints. The primary endpoint is the main reason of doing your study. What was the main thing that you had measured in the study? And please note that for one study, you must have 1 primary endpoint or perhaps 2 at the most. Okay, never more than that. The main point of your study becomes your primary endpoint, and then you can have perhaps 3 or 4 secondary endpoints as well that you in fact looked at and measured in your study. So the next 5 units of thought, these are the 5 paragraphs that should appear in your method section. The study design, what sort of a study is this? Retrospective, prospective, retro-pro. The patients, next paragraph. How did you select your patients? What patients were included? What patients were excluded, and why? The intervention that was performed, what was done? There should be sufficient detail in it so that somebody who is reading knows exactly what you did. The 4th paragraph is the outcome measurements. Okay, what did you measure? What parameters did you record? When did you record them? Okay, the 4th paragraph, the outcome assessment, and finally, what statistics were used. So these are your 5 paragraphs of the methods, your next 5 units of thought, and take them one at a time. As you can see, they are all very distinct from each other. The next segment, the results. So when we talk about results, we just talk about what did we find. That's it. So the story of the main findings. Now, your main findings should be a blend of text and figures. And what sorts of figures? You can have graphs, you can have bar diagrams, you can have charts, you can have tables. Okay, make it a mixture. So a blend of text and these figures. And do not in fact repeat the information that has gone in a table again in the text. It's a waste of time. So be concise, like we keep saying, and do not interpret your results here. Okay, in this segment, you just have to state your results and confine yourself there. And the final segment on discussion. So what does it mean? Okay, when we talk about this segment on discussion, it is about, so what does it mean? So your first paragraph normally should consist of what you did and what you found. So a concise statement about what was done and what was found in your study in the first paragraph. Then subsequently, you start talking about limitations of your study. Be upfront when it comes to talking about limitations of your study, because this shows that you are a humble chap. Okay, the reviewers like to read papers from humble chaps, and so do the editors. So if you can state, right up front about limitations of the study, everybody, relaxes a bit. They feel good that you have pointed it out yourself. Now, strengths of the study, shouldn't come right up there. Talk very little about the strengths, and particularly it's about making statements like the first study. When somebody reads the first study, for example, as a reviewer or an editor, it starts ringing, alarm bells. So be very careful about your sort of use of phrases. You can point out certain strengths in your study, but try and avoid terms like first case and first report and stuff like that. Now, you found something in your study. How does this fit in with the other studies that are there in literature already? So compare and contrast study with similar studies in literature. And please remember, when it comes to discussion, you must not just state what you found, but you must also talk about why you found what you found. So I'll talk about pros, cons, okay, and finally about the implications of your study. So you did something, you found something. So what? So what do you state now? Do you want there should be further research, perhaps in some branch where we still don't have all the answers? Should there be some change in policy as far as patient management is concerned? Should there be a little change in clinical practice, based on what you found? So discuss about the implications of your study. A small segment of conclusion where you have to be extremely careful. Now, do not put in something in the conclusion that you have not studied, for which you have no data that you have written about. So don't talk about things you have not studied at all in the conclusion. And go back right to the introduction segment, the second paragraph that talks about why you did this study. And that should align with your statements over here. Please remember, right at the end, very important, if you have done previous bits well, but then falter right at the conclusion and talk about things that you have not even studied or recorded or provided data for, it is like a big red flag for the reviewer, for the editors. So while referencing, most commonly Vancouver system for references works throughout the world. Now, people sometimes ask what should be the correct order to write. No hard and fast rules again, but normally what some authors suggest is perhaps you can do methods and results first, which means what you did and what you found first, followed with the introduction and discussion, and last of all, title and abstract. But this is something that can vary, so don't worry about this at all. Now, the role of a biostatistician. Now, this is something that I feel very strongly about, because though this is a breed that instills a lot of fear and distaste in us, okay, as surgeons, but let me tell you, this is a breed that we need for surgical writing and publishing. And you can see over here, why you need them. Right from the stage of protocol development, when you are writing up your study protocol, to the management of your data, to when you are collecting data for your study, during that process as well, you will need a biostatistician. He can keep monitoring what is going on with your study from time to time. And finally, of course, data analysis. There are scripts, there are parts of the manuscript that he can write for you as well, about statistics, for example. So if you ask me in one sentence, what is the role of a biostatistician? It is to sex things up. The biostatistician makes it more glamorous. The biostatistician makes your work more attractive. So how to get started? Okay, find one clear message. Please note, just one message per article, is what is required. You don't need too many messages in one article. It defeats your purpose. And write it down as a simple sentence of 10 to 14 words. So where do you get a clear message from? A clear message comes from a clear research question. And like Sandeep showed you a while ago, a clear research question stems from the PICO acronym, which is which patients, what sort of an intervention, what comparison, and what were the outcomes. So a clear message comes from a clear research question. Now, you don't want to be doing research that is not relevant. You don't want to be doing research that is not required. You don't want to be doing research that is futile, like what I just came across a few months ago. This sort of a research helps nobody. So this is one very clear message that stems from a PICO acronym again. Gallbladder removal from the umbilical port leads to a greater incidence of port site hernia. So what were the patients? Patients that had gallbladder removal. The umbilical, what was the intervention? Laparoscopic cholecystectomy. Do we have comparison? Yes. Those patients that had gallbladder removal from the epigastric port. What were the outcomes? A port site hernia. So a clear message from a clear research question. Okay, one more example of a clear message. Transabdominal sutures to fix meshes in laparoscopic incisional hernia repair leads to more postoperative pain. So patients, those having laparoscopic ventral incisional hernia repair. The intervention, laparoscopic incisional hernia repair. Comparison, yes, those patients that did not have transabdominal sutures. And what were the outcomes? Post-operative pain. So a clear message from a clear research question. And this is something I will not spend time on because Sandeep has talked about this. There are fairly standard guidelines in most surgical journals, and you will see that most surgical journals would follow these two guidelines. The International Committee of Medical Journal Editors. Now these wise men sat down together and formulated a set of guidelines which is being followed universally throughout the world, in different journals. And of course, the COPE guidelines. These are the ones that are talked about in most surgical journals. So most surgical journals would in fact require a statement from you that says that you had sought and you had approval from your local ethics committee. People will be happy if you can demonstrate to them your registration of study as a clinical trial and of course follow guidelines. Now, just a few words about data management, just to show you that you have to be very careful about what you put in, because what comes out depends on what you put in. So be very meticulous about your data entry. Now, a start can be perhaps, look at the most common 7, 8, or 10 operations that you do and start feeding in data in drop-down boxes, style, just one tool choose from multiple choices. That is the way you can build up data of your patients, pre-operative, intraoperative, and post-operative as well. It can be stored in any manner, but then when it needs to be sort of analyzed, then the Microsoft Excel worksheet is a pretty a standard form where you can place your data, and this is some software that you can have quite readily that can in fact analyze your data when that is presented in the form of a Microsoft Excel worksheet. So when you do that, you can have bar diagrams and figures and charts and stuff like that makes your data that much more attractive and logical. So finally, ladies and gentlemen, if you want something you never had, you have to do something you have never done. So that's about taking the first few baby steps into medical writing. Thank you for your attention.
Thank you, Dr. Sharma. I think that was very enlightening and comprehensive coverage of our topic to begin with, because this is just the end of the first day. We are going to have many more presentations tomorrow in continuity. And before we take the questions, let me tell you, tomorrow we are going to have another talk by Dr. Sharma on how to write the structure. And Dr. Deepraj Bhandarkar is going to cover how to write a case report. And Dr. Anil Sharma will talk about titles, abstracts, tables, and figures. And Dr. Sandeep Aggarwal is going to speak on why are articles rejected. And then probably the most important of all, ethics and publication by Dr. Deepraj Bhandarkar. So I think we have a lot more to come tomorrow. And I'm told that Dr. Sandeep Kumar wants to leave early. Dr. Sandeep, do you want to have any observations about today's presentations? And then we'll start with questions. Okay. So I think I'll take few questions as we go along. And the questions which have already been answered, like there is a question on what are the criteria to have good publications. I think this is all what we are discussing in 2 days. It's too broad a question, and this is what is going to be covered. A specific question, Dr. Sharma, is it always necessary to start with summary while writing? So do you write an abstract first, or a summary of what, or how do you start writing a paper?
Yeah, so we will actually get into the structure of writing a paper tomorrow first presentation. But what I find useful is like I had shown in the slide earlier. First, try and get one clear message for your article out there in your mind, and then write it down. Should be a simple basic sentence, and then paste it on your board where you can in fact keep seeing it regularly as you keep writing. So one clear message, and these 20 units of thought that we had talked about some time ago. We go through those 20 units of thought tomorrow one by one, because like I said, you can't think about the entire article just in one go. The entire article has got to be broken down into much smaller units. And these smaller units, these are in fact very well-defined units. So we will see this, the first presentation tomorrow that talks about the structure of how you start writing a paper.
Yeah, I think one point that has come out pretty well today, and I've been finding it very challenging, is that the research question. So there are multi-centric studies that, and when we discuss it with the other surgeons, they are in the process of collecting a lot of data without clarity of what is the research question in their mind. And they feel that once you have data, you will find what is relevant. I think this is a very negative way of looking at it, because there is no purpose or focus in your collection of data. While if you had the research question in mind, you will collect it based on that research question, rather than having a pile of data which is of no use, and it's a waste of effort on everybody's part.
And there is, Raman, some role of deductive research in large data analysis. Now, because of these mobile companies and Google things, so if you have a simpler research question, a generic research question, that can be a deductive research question. But you are absolutely right that for a purposeful, short scientific paper, as has been alluded by earlier speakers, there has to be one good research question, one set of data collection, one primary endpoint, one or two secondary endpoint, one good answer, and that's your boon in the dhara of or the ocean of knowledge, and that's what correct. But there is something nowadays known as deductive research.
Okay. Deepraj, you wanted to add something?
Yeah, so just a couple of points I would like to make here. One is somebody's asked whether it's a good idea to write the summary or the abstract. Now, the word summary itself suggests you're summarizing what you've already written. So, although the summary or the abstract appears as the first piece in any article, that in fact you have to resist the temptation to write that as the first piece, because once you have your clear thought process, once you have the methodology, once you have the results, the discussion, the abstract has to be written at the end of that whole process. One more thing about abstract is, once you're writing the abstract, be 100% sure that there is no conflict in any numbers or data between the abstract and what has been written in the main paper, because that is something that is frowned upon by both the reviewers as well as the editors. One final thought I would like to give to the people who sometimes feel overwhelmed with the idea of writing a paper or starting to write a paper, and there just seems to be so much to be done. Anil will show us tomorrow. He's got a beautiful presentation on this. I've heard it before, on the idea of units of thoughts. And what I would suggest to a young writer who's starting on this journey is to not think about the entire paper to start with. You just have to say that, yes, I need to get my materials and methods section written over, say, 5 days or a week. Leave that aside and then say, yes, now I'm just focusing on the result section. So at that time, when you're writing these units of thoughts, don't let the idea about writing the discussion, comparing your data with other people's data cross your mind, because it sometimes becomes too overwhelming to try and cope with it. So the idea is to do so. Essentially, in so many areas of our lives, if we break down the task into smaller tasks, they become more manageable.
Yeah. Okay. All right. There is another question. I am a beginner. Want to start. Right? We have taken it there. How and when to submit the article in a best journal? So if there is a beginner, should he try not such a good journal which will accept his paper, or he should try the best journal? I mean, how does one prioritize a journal, or how does one select a journal? Basically, the person is asking that.
Shall I answer?
Yeah, sure.
Yeah.
I think the way I have been telling my students is to have it peer reviewed. Have a guru around you, and he will let you know. Because as a beginner, you may be doing it for your boss, for somebody, and that somebody may be having big ideas and maybe very aspirant of sending it to a bigger journal. So beginner doesn't really mean, but if it is an article, you're a beginner, it's your thesis article, it's entirely on your behest, you should really go in for a journal which is reputed to give you a good review, and where you think there will not be just one line rejection. So you should, as was already said by the person, you should carefully, Sandeep Aggarwal, I think he said it, that you should carefully read the instructions to the authors. You should first see that it is in the scope of the journal. You should have it assessed by some senior who has been publishing, that is it worth sending it to a very high profile journal, and then you should submit it.
Can I add to that?
Yeah, sure.
Yeah. So there are two ways, as I said in my talk, if somebody is looking for a quick publication, then I think the best thing is to have a look at the publication time. But what Dr. Sandeep Kumar said is what is actually the right thing to do if you have enough time on your hand is to send it to a good journal, get good reviews to improve your paper. That really helps tremendously. You see some of the submissions, the reviews sent by journals like SOAR, they're really good. Even if they reject your manuscript, they yourselves feel, yes, we have missed out on a lot of things.
Okay. Okay, so we move on to the next question, and I think this will go to Dr. Sharma because he talks so much about statistics and a statistician. So which statistical tests are commonly used in medical studies to analyze data, and how to decide which method should be applied for a particular analysis? So I think all of you can take this. Is a very important question. Dr. Sharma, start with you. You will have to unmute yourself.
This may be a very important question, but then also a question that is most likely, going to be sort of avoided by most people to give an answer. See, what we are in fact talking about over here is about 60 to about 70% of the course content that has been created, for this course. Now, the statistical methods was in fact one of them, which we have not put out here.
I can try and answer that question, Dr.
this being the first edition. So yes, now what sort of tests to use, where to use, is too broad a subject for me to try and answer. Perhaps Prof. Sandeep Kumar has an answer to this. Yes, Prof.
I'll try and do it very quickly. It's a very big question, but for the young person, see, there are two types of tests: parametric, non-parametric. Tests are done for comparison purposes. You have to compare it either with the cohort which is running parallel or in a randomized situation. You have to know that in a case control study, you get odds ratio and the confidence interval. Confidence interval is that interval in which your median value, the mean value, the mu is likely to fall. And that will tell you whether the data is significant or not significant. So all data will have nominal percentages, which is known as the percent, or will have proportions. So some of these words will not make sense to you, but you must know what is a ratio, what is a proportion, what is a percentage, what are the central tendencies. Central tendencies are mean, mode, and medians. After you've done it, then you have to see if there are two groups that are being compared. Then you have to see whether the data is normally distributed. If the data is normally distributed, then you run the t-test. T-test is paired, unpaired. If you have done before and after test, that is the same group of people have been treated or have an intervention earlier and then another intervention later, then you have a paired t-test for a data which is normally distributed. For a non-normally distributed, you use non-parametric tests like Mann-Whitney's U-test. And then if you have a correlation data, again you have a parametric correlation, which is a Spearman correlation, and a non-parametric correlation. If you are comparing an outcome with multiple predictors, then you have what is known as a multivariate analysis. So that's the answer in short, but then this may appear to be a very complicated answer to the person who has asked it, but that is how one would enumerate it in 5 minutes. You have to learn these words: what is univariate analysis, what is multivariate analysis, what is a parametric test, what is kurtosis, what is normal distribution. If you know these words, this language will start making sense to you. I didn't want to use a jargon here, but that's the answer that I could best think of in 5 minutes.
Thank you, Dr. Sandeep. Deepraj, do you want to add something or to make it look a little more simpler?
No, I think for the statistics person, I would always say that it's best to take the help of a statistician, because as surgeons or as clinicians, there are very few people, very few of us who are totally familiar with all the statistical aspects of writing a paper. And it is important to engage the statistician right in the beginning at the stage of formulating the research question. If it's a study in which you are trying to enroll a certain number of patients, he would be able to give you an idea of what is the adequate number of patients that you need to enroll into that study. So the help of a statistician, which most larger institutes would have, if you're not in a large institute, if you're in a private hospital, you can still find somebody in a nearby teaching hospital, or not necessarily a medical teaching hospital. You can even find them in universities or colleges. There will be a department of statistics. And more often than not, I have found that if you approach a person and you find him helpful, you can then interact with him and get more. And over a period of time, you would get familiar yourself on how to, which tests are used.
Okay. I think, Sandeep, if there is nothing much to add, we can move on to the next question.
Sure.
Yeah. So there is a question that if somebody is writing his first paper, is a newcomer into publication, should he choose an open access journal or a journal with high impact factor? So I think we are basically coming to this. Is open access journal better to publish, or is impact factor an important determinant?
No, I think these are two different things. Open access is different from impact factor. An open access journal can have a good impact factor. So what I was cautioning about is that predatory journals, which you keep getting emails about, which have no substance. So open access is good when you have a good article which you want to share with the society at large. I mean, with a lot of wider audience, but you need to pay for it unless your institution has a license. So everybody would like to ultimately publish open access because it gives wide publicity to your article. But then again, the issue of cost and charges are there. So if you can't do that, then obviously you go in. So the impact factor is totally different. So impact factor is again a sort of a measure of your own article. How good you think your article is, and what are the publication times and all. I mean, I would rather have a article published in a slightly lower impact in a journal rather than a higher impact journal who takes 2 years. Okay. So I think those are the variables you have to look at.
Okay, there is an important question. If some faculty has left their previous institute and now he wants to publish their work which they have done in the previous institute, what should be his or her affiliation, and whether newly joined institute or past institute? So this is for somebody who has moved from one institution to another institution. So any ideas or suggestions?
I mean, I think the paper would get published from the institute where the author is currently, but in some section, it is fair to mention that the research was carried out at such and such place. And in these kind of scenarios, it's fair that the co-authors should be from the previous institute also, because it's not fair for a person to take a data or a pool of research which was done at an institution and publish it from another institution without any of the members from the first institution being the co-author, because this is exactly the kind of thing that may subsequently lead to the editorial board getting letters from the authors from the first institution that our data has been taken away and it's been published without our consent or without our names in the authors list.
I think there's also a different aspect to it. So supposing one of your fellows who was working helped in conceptual and design, and while submission he has already moved on, I think that it's best to mention that at the time of work, he was affiliated with our own institute. So I think that's the way it's done actually. So you write his current affiliation, but somewhere in the, put an asterisk and say at the time of writing the work or conceptualization of the research, he was working with us.
Okay. Another question, this is about salami slicing that we had discussed earlier. The definition of salami slicing seems a little subjective. Will the umpteen papers from SOS study, Swedish obese subjects study, be considered as salami slicing? Now that study is going on for more than 20 years and they had publications every 5 years of follow-up. So I don't think salami slicing applies for that. It was being discussed from one data set and you have multiple publications. So is that the way to look at it? Any other suggestions or observations?
So again, as I said earlier, I mean, can I answer that or Anil?
Yeah. No.
So as I said, if you look at postgraduate thesis, which work over 2 years out of the 3 years, we said strictly no to a salami slicing. No, absolutely no. Just publish one paper. But if it's a PhD thesis working over 5 to 7 years, and they have several sort of verticals to their research, they're fairly okay to write several articles related to those verticals. And in case of an SOS study, it's obviously perfectly justified. It's a huge database over a number of years, and people are going to benefit. You have to look at the benefit. I mean, it's going to be benefit of so many people by their publishing papers of that really a good database. There's no objection to that.
Yeah, there is a question from Dr. Vishnu. Case series study is a descriptive observational study, whereas nested case control study is an analytical study. Is it correct?
No, sorry, I didn't get the last part of the question.
Nested case control study is an analytical study. So they are saying case series study is a descriptive observational study versus nested case control study, which is an analytical study.
So what is the question exactly? I mean, what
is a play of words. I find it difficult to comprehend.
what I will do is I'll share this statement in the group, and maybe tomorrow you can go through it and come back on
Sure,
it.
we'll do that. Yeah.
Okay. And then there is a question on ethical permission is part of responsible conduct of research and for safety and security of study participants. Your thoughts, please. Deepraj,
Yeah, we're going to touch upon some of the ethical aspects in tomorrow's talk. So I think we'll leave it for that.
Okay. Okay. How can I know about index journals? So how does one get access to the list of index journals?
No, instead of looking for the list of index journal, I think each journal's website, when you go to the submission page or the journal website itself, they would have information available as to which authorities the journal is indexed with. So that's probably the best place to do it, because that is more likely to be up to date rather than a database carrying a list of thousands of journals.
Okay. There is an very basic question, but I think so relevant. Dr. Vasia Shekhaji is asking, sir, how to decide what to write? Should it be interesting cases or rare cases or routine cases with unusual presentation? So the very concept of research and writing is being questioned. How does one decide what should we write? So Dr. Sharma, would you like to?
Yeah, so I go back to a slide that I had shown, which talked about the three most simple things to write. That starts from a case report, where it is fairly simply actually, you just talk about the case report that you had seen and treated, and then look at literature surrounding that. It's a very small format, not too much to, I think, research or worry about in terms of scientific writing. The second thing, like I mentioned, was the surgical technique, the how I do it, and there I had mentioned that you can in fact talk about one small part of the operation also that you think is relevant, that makes the surgery safer, that saves some time in the surgery, that makes the surgery simpler to do. So that is also something relatively simple to write. The third thing that I talked about was the case series. Now, the case series also should be considered fairly simple to write, because the case series just talks about what you did and what you found. There is no sort of question about patient selection, about surgical technique, about this, that, and the other. You just have to report what you did and what you found. The I think limiting factor being that you have to be very careful about conclusions that you can draw from a case series. So if it is only, I think, general conclusions that can be drawn from a case series. For example, this is safe. This particular operation was found to be feasible. This particular operation was found to have satisfactory outcomes in our experience. But you cannot compare one treatment with the other with a case series. So a case series that way is I think relatively simple to write up and present as well.
Okay. I think we have
Raman, can I just add to that?
Yeah, sure, Deepraj.
Yeah. So I think the fundamental question when you want to write something that you need to ask yourself is what is said often about when you speak. Are you trying to say something because you have something to say, or are you saying something just because you want to say something? So the same thing can apply to writing. Do you really have a clear or a new message to convey, or you want to write something just for the sake of it so that you want a publication on your name? And this is where the importance of studying what has been written on that topic beforehand comes into play. Because if you study the literature hard enough, and if you say that, okay, for example, I have done this case, I have removed a 5 kg lipoma from somebody's back. Now, is that going to be of interest to the readers? Are the readers going to learn something out of it to affect their own clinical practice? Is it so rare? You may have done it for the first time in your life, but does it mean that this is one of those cases that, and this is the criteria that the editors would apply also, that is it something that's going to change the practice? Is it something so strikingly new that the readers need to know about it? And if the honest question to that is no, then you should probably shelve that idea. So like so many things in life, you will probably come up with, once you start thinking on those lines, you'll come up with maybe 10, 15, 20 ideas for writing something. But actually there may be just one or two worth pursuing. So that's the, sort of self-control that you need to have, that you don't start writing every idea that comes to your mind, but take the time to do the search and the research to see which of them is actually worth putting forward.
Okay. So I think we are on the last question, and it probably is for me, that says that if we are collecting the data specifically for a research question, is there a possibility of missing a data point which can be significant in later studies? What should we do if this happens? So, friend, whoever has asked this, one thing is that we are today talking about publication part of it. We are not talking of the research part of it. Research is a entirely separate ballgame. But yes, it's important. So there's a difference between a registry or data keeping versus a research. So if you are, like what Dr. Sandeep Kumar was saying, deductive analysis from data, that comes from research, from the registry. So if you are collecting data as part of your, just the data keeping of what you're doing, you can always have some deductive answers from there. But typically a research must have a specific research question, because, and then the question of missing out points should not arise. You should spend more time designing the Excel sheet than interpreting it. If you've designed the Excel sheet very well with proper coding, the interpretation becomes extremely simple. So this discussion should take place before you design the Excel sheet, so that you don't miss out on any point that you may repent later, 1 year or 2 years down the line. Oh God, we forgot to ask the gender of the patient, or we don't have the age of the patient, which is so relevant to your research question. So I think this is what I feel about this. And if you have missed out on something, it's really so painful. You feel miserable. So it's better to spend time when you're starting a research than at the end of it, because it's easier to do that. Any comments, Sandeep? You want to add something to this?
No, I think it's well said. I think you said whatever was required.
Yeah. Okay. Another question has just come now, and I think this is also very relevant. Sir, how important is author processing fee a factor in selection of a journal for publication? So, Deepraj, would you like to say this, since JMAS does not charge Indian authors for the publication, but how important is to decide which journal one should submit?
Yeah. Okay, so I'll give you just a little bit of a background on this as to why author processing fees are charged. If you look at any journal, starting with the top ranked journals, so journals often journals for running the journal have to generate revenues. So that revenue can come from several sources. It can come from societies. Today that is becoming less and less prevalent. Or the journal is with a big publishing house, and the publisher is generating money by way of providing people access to their full text articles that charge $30, $40. They're being charged so this is one way of collecting money from the readership or from the subscribers. If a journal is open access, it necessarily means that it is not receiving all those fees. For example, Journal of Minimal Access Surgery about 3 years back decided a policy that we would charge only the foreign authors certain fees to make up for the journal's subsistence. You have to be very careful if a journal is asking you for fee for submission of an article, more likely than not, it falls into the category of what is called as the predatory journal. There are several of these publishing houses coming out of or been existing out of China. And they are huge publishing houses. They would have a journal in every specialty under the sun. So there'll be an international is a common word with them. International Journal of Surgery, International Journal of Gastroenterology, International Journal of Hematology, International Journal of Dermatology, everything. And these papers, these articles, these journals would ask you to pay a certain amount upfront before the article is processed. So the article processing fee at the end of the peer review process, when it is asked, it means that the journal is trying to be impartial in judging the merit of your article, whether it's worthy of publication or not. And the fee is charged only after the article is deemed suitable for publication. So article processing fee, if it is being charged upfront, it invariably should raise a red flag that this journal that means going to take shortcuts as far as the peer review process is concerned, and the article is going to get published. You will have a publication on your CV, but anybody who understands this nuance, looks at your CV, is going to say, oh, this article was published just because he coughed up a certain amount of money. Mind you, these author processing fees from some of these journals could go up to about $1,000, $1,200, $1,500. So you really have to ask yourself a question whether you want to spend that kind of money to get your articles published in not so reputed a journal.
Okay, so thank you so much, all the three speakers, and Dr. Sandeep Kumar, editor of Indian Journal of Surgery, for joining us today. Friends, tomorrow we are again starting at 4 o'clock. If you have any questions, keep sending those questions. We'll take each and every of you. This course is basically for medical writing. IAGS this year has started a research committee. Dr. Sandeep Aggarwal and Dr. Kanagvel are the conveners for the research committee. And we are trying to create a research orientation through IAGS. And we hope to collect some data for short data analysis and maybe have long-term studies, prospective studies also in future. So thank you so much, Dr. Sharma, Dr. Sandeep Aggarwal, Dr. Deepraj Bhandarkar, and Dr. Sandeep Kumar, and Professor Dr. Pradeep Chaube for joining us today. And we hope to see you again tomorrow, 4 o'clock. Thank you.
Thank you, Raman.
Thank you, Dr. Raman. Thank you.
Thank you.